Hi, everybody, and welcome to the Frank and Lizzie Show. I'm Liz Faust, and I have the honor of co-hosting with Frank.
And I'm Frank Avales. I'm her other half at work.
Yes. So today we have the honor of speaking with our guest from MPM Medical. So welcome, Mark Overcash.
Thank you very much.
Yeah, so
Welcome.
he's a registered nurse of over 25 years, and over 20 of that has been in the wound care space.
Absolutely.
Overcash has been a name in my wound care clinic for years. So joining us at SAWC Fall from MPM Medical. So I'm going to start off a little politically incorrect, I guess, because I heard this rumor, and so I'm going to fact check you. So I heard that at MPM Medical that all of the wound care sales associates are wound care certified. True or false?
True, absolutely. Actually just finished up mine. I've been with MPM since February of this year. Just got my certification last week and highly recommend it, just to be able to speak with clinicians' terminology, prevention, competitor products, really just give us that focus and that standard of care to be able to speak with clinicians across the board when we're educating.
Great commitment.
Wow. It is a commitment. And one of the things that I'm impressed with MPM Medical is that you guys look at current research, market research. We all know that, if you didn't know, that by the year 2028, it's going to be an increase of 40% in there. But what has MPM Medical found in your current market research?
Well, absolutely. And MPM has always stood behind market research, whether with patients or with clinicians, providers. The two biggest things that we always see is with heavily exudating wounds and infection protocols and skincare protocols, and we follow that.
Well, certainly a big problem in the wound care space
Absolutely.
is infection
Absolutely.
and exudate.
Absolutely.
Right.
Yeah.
In the lymphedema world, too, because that's what we're facing all the time.
Sure.
Yeah.
So let's go ahead and tell us a little bit more about, your market research.
Absolutely. Some of the findings that we've had is that the dressing choices revolve around clinicians want things that are covered. Fluid retention, antimicrobial ability of the dressing, ease of use, and just the ability to the healing properties of it. And a lot of times those things fall into place with the healing properties, obviously.
Yeah, for sure.
Changes that we want to see in current dressings is cost reduction. That's always a comment. Better adhesives, skin safety protocols for sensitive skin. Better moisture retention in the dressing. You can absorb everything you want into the dressing. If you roll on it, it spills back out. It does you no good. Our products really have done a great job of retaining that dressing moisture. And more sizes. We get quite a bit of, could you make it in this size? You launch 4 sizes and somebody may want a little bit different size. Takes us a little bit, but we can do that. When we really see the feedback that that's what somebody wants is a 2x3 or a 3x3, we can do that pretty easily.
Yeah. Well, I know MPM Medical hasn't always been on my radar, but I know the company's been around for a very long time. So can you give me just like a brief history of what
Sure.
the background of the company is and kind of how long it's come?
Absolutely. First got into the wound care market in 1992 with feedback from clinicians of what they were looking for. Our first real launch into the advanced wound care was in 2002 with RegeneCare, which was a hydrogel with lidocaine in it.
Oh, wow.
Okay. In 2008, over the years of having that product, we rebranded it with hyaluronic acid into the way. So it became, you may know it today,
Even
is
better.
even better. Collagen, some aloe, and it's a great product today. Even just recently, we've made some additional changes to the product to give it even more hyaluronic acid. And we've made it no prescription needed. It's over the counter now.
So you started out in a hydrogel space, but we just talked about exudate management. So how did we jump to that?
Other end of the spectrum. Our first product that MPM launched into the heavily exudating space was the super absorbent polymers, which was a product called DryMax Extra. And it's amazing products. Even though I've just been with them a short time, it's the in-service magic trick. You show the product and the whole bowl of water's gone with the trick. Really impressive. And people start calling out patients that they need that for.
Yeah.
And for a rep, that's a great feeling.
Right.
Shortly after that, understanding super absorbent polymers came out with what clinicians asked for, which was a silicone, including silicone. Once everybody could get silicone, providers love it. that had either a border on it or just across the face of the wound if you were going to use it. Still with the super absorbent properties, but with the addition of silicone action. That product's called Excel SAP. And that was actually brought to us with clinical feedback saying, DryMax is great, wonderful product, but for these situations, we really like MPM developed it.
Great.
Just fantastic.
I like that. And they've been around since '92, long before you were born.
Yeah, completely.
In 2016, again, with feedback from clinicians, we've launched Triple Helix Collagen, which is 100% bovine collagen, just doing fantastic on the market. Clinicians love it. And some additional products that we're going to launch, just learning from that customer feedback.
Well, great. Well, I think we have a Frank and Lizzie exclusive announcement, which is a first for us.
Right.
So I'm so excited. So we get the opportunity of introducing our audience to a new silver silicone absorbent called TriSAP.
Absolutely. First product to market that is a silicone super absorbent and with silver antimicrobial properties.
That's like a triple hitter, hence the tri.
Yep.
Yeah.
Triple threat, trifecta, trilogy, and trinity all in one. That's what the clinicians do name that. They do name it those things.
Yeah.
And very excited to have this before a launch, to have this much excitement, to have a clinician tell you that's exactly what we've been asking for.
Yeah.
Smaller company that's able to make things happen, and it's really impressive.
Well, certainly that's tying in your market research. People want
Absolutely.
bacterial control, super absorbent, but also that skin-friendly option. So those three things, the silver, the super absorber, and the silicone is really bringing all of that together. That's lovely.
Right, but I want to tell you that I'm glad that you're concentrating not just on the wound, but the peri-wound, and that you mentioned that earlier, because I've been saying for years, we have products that are supposed to be lasting up to so many days, and the products that I have in my clinic are not able to get me to 7 days.
Yeah,
Right.
yeah.
Absolutely.
Certainly what you pick in your toolkit is really important. So that begs to question, when will this become a part of my toolkit?
Absolutely. Our plan is to launch it at SAWC spring next year, doing some really robust research on it right now.
Great.
We'll show a couple of case studies, but just absolute fantastic results for clinicians and for wound healing.
And before you show the case studies, I'm kind of curious because you have different products. Is this replacing something in your kit?
Absolutely. Two of the most common products for heavily exudating wounds are going to be alginates and foams. And the case studies that we've done so far, we've replaced the two of them. Both of them. Where you have a situation where a foam is maybe a 3-day, but your alginate really could be a daily for absorption. That doesn't match.
Right.
This is a situation where you have more absorptive properties in a super absorbent than both of those products together, right? As far as insurance coverage, it could be covered up to daily if you needed it to.
Oh, love that.
I like that.
Yeah.
The other thing I like is that I'm going back to our outpatient clinic, and I remember our price per patient would go up because to chase the drainage, they were combining different categories.
Oh, yeah. Or layering it on.
Exactly.
Layers.
Yeah.
So this is really going to simplify wound care
Yeah.
in this, because it's hitting all the top needs of what clinicians are looking for.
Yeah, and especially when we have a patient who has a high bacterial burden. In our home health population, we often see that they're limited in what they can use in terms of silvers, but when they have that high exudate or clinical signs of infection, we can really swap them to a silver, and sometimes it's limited for 2 weeks. Right. So to have this in your tool bag where you start to see that higher exudate, it's not only addressing the higher exudate, but the bacterial concern as well. At the same time, you're kind of like nipping it in the butt right
Absolutely.
away.
It's addressing all those concerns. And that the reduction in price for a super absorbent compared to foams and alginate gets people's attention. And we're just getting sometimes too many products. We have like mobile wound care providers, for example. I've done home health nursing for a long time, and you got a trunk of different products, small trunk, that it's a situation where you can go with something that's safe and effective, covers all areas.
Right. Because in '91 is when I started practicing. That kind of dates me now.
Yeah.
But I'm going to tell you that we only had a handful of products back then. Let's just say a total of 200. Now we have thousands. And as a new clinician, it's tough to try to figure out all these different products.
For sure.
So let's kick off with the case studies.
Absolutely. I too started in I say in the 1900s, I started wound care. That really is really more impressive. But where you always had that mentor who was like, this is a hydrocolloid. You'll need nothing else. You won't need this. But we were doing, 3 times a day, twice a day ABD changes. So that kind of created the need for these. But now we're going to get back to the basics and address what we really needed to.
Sure.
So
great. So take us through the case studies. I know you brought 2 with you.
Okay, absolutely. This first one that you can see on the screen is a 58-year-old male presented to the wound care center with right posterior lower leg trauma, and the wound was secondary to recent motorcycle accident. Transition, exactly what we said before, from alginates and foams to just TriSAP SAP, and continued to use it under compression. The results were that the provider was impressed with the patient's reaction to the dressing surrounding the wound, peri-wound area, the lack of maceration and erythema around the wound that they had even with the foam and the alginate. And the patient was easily able to change the dressing, felt very satisfied and protected with the padding, the absorption and everything, and would like to use that dressing.
Yeah, and I see the silicone border, but there's no like harsh ridges or indents from that. And you said he was under compression,
Under
correct?
compression. You can see in the first photo that you'll see that indentation that,
Sure.
that the foam had left. We
Oh,
all
so
struggled
that
with
was from the
different- yeah.
previous dressing.
That was.
Good to clarify
So
that.
you won't see that on the
No, I
removal
don't-
of the dressing.
I don't see that on the
It's
right
7
at all
days.
after 7 days.
Very
No
happy with that.
maceration. I like that,
No.
especially if we're going to put compression on top of that. I like
Yeah.
that.
The second case study was a 76-year-old male with a history of peripheral artery disease, gangrene, and uncontrolled diabetes, as you can see. Presented to the wound care center with left anterior lower leg wound that had underlying venous insufficiency. So very similar in that case. There was initial concern about the peri-wound area from the previous dressings that were being used. And again, they were transitioned to TriSAP SAP from an alginate and a foam, and continued to use it under compression.
And that's just 5 days.
Correct.
Wow, look at the difference with that.
Right, and look at the swelling has decreased. So I know they were compressing and you don't see the indentation at least.
No,
So,
not at all.
Very happy to see that.
Yeah.
The provider was satisfied with the improvement within 5 days. The patient reported it was easy to apply, caused no pain upon application, and made him feel more protected, having that antimicrobial effect because they had a history of gangrene wound.
Oh, so yeah, worried about the
Yes.
infection. That's great. Excellent.
These studies were done by Allison Garten, a podiatric surgeon down in the Charlotte, North Carolina area.
Yep.
And this was her quote: "As a wound care physician, each patient brings their unique challenges. TriSAP gave her the confidence to not having to worry about fluctuating exudate levels and the flexibility to adjust to the changes that were needed. Addressing that should simplify care, and TriSAP offered peace of mind to providers while delivering enhanced benefits to the patient."
Yeah, that's great. I know certainly sometimes we see a patient back once a week, sometimes we see them once a month. So knowing that you have some flexibility within that and that they're not draining through or getting maceration or getting infected is certainly offering a lot of peace of mind and less phone calls. I say the less calls, the happier I am.
Absolutely. and very easy access to the products.
Yeah.
Through the primary vendor in the hospital.
Yeah.
That's usually a product that would see and go to materials management to champion.
Yeah.
To say this is what we need. So that's great from the sales perspective of it, but also very easy access from the DME market.
Sure, yeah. Well, certainly we'll look forward to touch, feel, play and grapevine at SAWC Spring with this product. I'm looking forward to getting my hands on some of it.
yeah, and me too. And as we close up, you went through the history of MPM, which I like that you did the market research, you listened to us. Tell us why, in a summary, why should we have TriSAP in our toolkit?
Well, I think we named quite a few things. We went back to the first slide of seeing that those are prioritized. Reduction in costs, reimbursement, access, antimicrobial. We've hit all of those things that we've done. We joked about the trifecta and triple threats. There's so many more benefits to this product than that. But it's kind of a go-to that wound care providers across the board can use. There's no reason not to to use those. We built this product line proving results with super absorbents and now adding the silver to it, already with a silicone border that providers know and really like.
Yeah.
I think I nailed it. I know we do, and that's why I'm doing the MPM launch of this product, and just so excited about the future of it.
Great, great. Well, thank you so much for joining us today. This has been wonderful to learn about this new product. Thank you. So excited to get my hands on it.
Me too. And I appreciate you being here, telling us about the history, and I'm looking forward to the launch. And we do have this exclusive for the Frank and Lizzie
It's
show.
our first.
Absolutely.
I appreciate it. Yeah. So be sure to like, follow, and subscribe to the Frank and Lizzie show to get all the updates. And of course, we look forward to a follow-up in the spring.